So at Women's Health Domain, we are all board-certified obstetrician gynecologists, which means we do OB and GYN. But in terms of obstetrics, we take care of our pregnant patients from the conception until postpartum. At our clinic, we take pride in the individualization of patients' care, meaning not one size fits all. But there are certain standards that each patient will get, regardless of their condition or their age, or et cetera. Ultrasounds at certain visits will be expected and will happen. There may be more along the way, but there's a guaranteed number of ultrasounds for each pregnancy, but there could be more depending on the indications or complications. At Women's Health Domain, we take care of low-risk pregnancies, as in one pregnancy with one baby, but we also take care of multiples and other high-risk pregnancies. We take care of many IVF patients, so we're well-versed in all of these complications or high-risk obstetrical complications. With our high-risk OB patients, we collaborate with the Maternal Fetal Medicine Group, MFM, here on campus, who work closely with us and help make management decisions and guidance individualized to the patient. At Women's Health Domain, for your obstetrical appointments, we also have ultrasounds in-house, which I mentioned earlier, but they will be the same time as your visits, which we pride ourselves that this streamlines your appointments. You won't be making multiple trips to the clinic that week or going off-site for ultrasound at an outside imaging facility. All these things are done in-house. Along those lines, we also have lab in-house. If you have a lab draw that needed, it will be done that day at your appointment, before or after your appointment. So this also streamlines the patient's week, the day. They're busy, they're just like the rest of us, so if we can maximize their time, we think that it's a win-win for everybody. As far as the obstetrical visits, at the first visit, we'll lay out kind of a roadmap for the entire pregnancy. We'll see you back at X many weeks, and we'll break it down by trimesters: first trimester, second trimester, third trimester, and kind of what to expect and what to watch out for, milestones, those kinds of things, routine labs that we've done along the way. That stuff is all discussed at the first visit, and then along the way, patients at those routine visits, they can bring up anything they want to. The floor is theirs. And in between visits, I always stress that they can contact us seamlessly via the patient portal, and we all work very efficiently to make sure patients are answered back within 24 hours. The obstetrical care doesn't end with the delivery, as we all know. The postpartum period is very important, and there'll be a postpartum visit scheduled automatically once our patients deliver. And that's usually for 5 to 6 weeks unless there's extenuating circumstances. And at that postpartum visit, we talk about all kinds of things, including getting back to normal life and future pregnancies or preventing future pregnancies, whatever the case may be. Again, back to the mantra of Women's Health Domain, we individualize the care. It's not one size fits all. It's what's best for her.